Hey guys, Dr. Stephanie here, and if you have pain on the outside of your elbow, kind of on this little bony area right here, that is known as tennis elbow or lateral epicondylitis. So all of these muscles right here that extend the wrist like this, they all attach, but their tendons attach to this lateral epicondyle, this little bony piece right here, and that's part of the humerus, this bone right here. It's kind of the end of it, a little bony prominence, and those tendons attach there. So when you do any sort of repetitive activity like typing at a computer, using a mouse, using your phone a lot, painting, cooking, even playing tennis or playing golf, other sports, it can irritate those tendons and cause pain in that area. So in order to get rid of that, we need to work on reducing stress here. So when you do your activities, maybe decrease the amount of the activity, but also just try to keep your wrist in a more neutral position. Try not to leave it just up in this extended position too long, but also working on strengthening the muscles of the forearm and the wrist and the hand. And then also looking up at the shoulder, because the stronger your shoulder is, the less stress will be put on your elbow, wrist, and hand. So we're going to go through some exercises that can help reduce tennis elbow and then prevent it in the future as well. So for the first one, grab onto a small dumbbell like this, and we're going to do these dumbbell rotations. So you want to grab it in both hands. You're going to take one hand first and just rotate it forward, and then grab it on the bottom with the other hand and rotate forward. So you're just going to alternate rotating just nice and slow like this. And keep your elbows bent. And do this for about 20 to 30 seconds. And then take a break and do that 1 to 2 more times. So 2 to 3 sets of 30 seconds, or 20 seconds if you're just starting out. And use a weight that will feel challenging, but not too heavy, not too difficult to do. Okay, so after that, you're gonna grab this weight on the bottom. The bottom of the weight here, keep your elbow bent. You can kind of hold on to your elbow if you want to, but you don't have to. We're gonna do what's called radial deviation. You're just going to lift this weight up towards the ceiling, kind of bringing your thumb up towards the ceiling, up towards you. Kind of show you from the side as well. Just kind of bringing that hand up. Most of the movement is coming from the hand. Just up and down. You want to do 2 to 3 sets of 10. And then we're going to keep holding on to the bottom here, and we're going to do what's called, this is supination and pronation. And just slowly back and forth. Really working those muscles in the forearm, nice and slow. The slower you go, the more it works those muscles. Of course, you don't want to go too slow, but you do want to do nice and slow and controlled. 2 to 3 sets of 10 of this one. Then one more holding the bottom of the weight. We're going to make circles here. And you want the motion to be coming from your hand. You don't want your whole arm moving. You're going to make a big circle. It's around like this. You want to do 2 to 3 sets of 10, and then you're going to take the weight and you're going to go in the opposite direction. 2 to 3 sets of 10. Just like that. And then we're going to grab both weights. So like I said, it's important to work on the shoulder strength too, because the stronger your shoulders are, the less stress will be put down your arm in the elbow, wrist, and hand. So for this one, you grab a weight in each hand. We're going to do a shoulder scaption with wrist extension. So we're working on shoulder strength and wrist strength at the same time. So you want to lift your arms up in kind of a V, like a 45-degree angle. So not straight in front of you, not straight out to the side. A V here to about 90 degrees. And then rotate your hands up towards the ceiling and then come back down. So lift up in a V, rotate up towards the ceiling and back down. You want to do 2 to 3 sets of 10 of this as well. And all of these exercises you can do daily, although if it's irritating your elbow, it's probably, or you're having a lot of pain to start out with, I would do these exercises every other day to begin with, and then you can start adding them every day. I would advise that you be patient because it can take a while to get rid of tennis elbow, but just be consistent with the exercises, be patient, and it will get better.